The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. The Crime and Justice Institute at Community Resources for Justice is pleased to welcome you to the Wednesday series, Using Science and Criminal Justice to Achieve Better Results. Today's webinar is titled, Effective Clinical Practices in Treating Clients in the Criminal Justice System. Hello, everyone. My name is Kate Florio-Keegan, and I am the Director of Business Development and Planning at the Crime and Justice Institute. In support of CRJ's mission, CJI provides nonpartisan consulting, policy analysis, and research services to improve public safety in communities throughout the country. We work with a diverse group of practitioners and policymakers, including corrections officials, courts, law enforcement, political, and community leaders in local and state jurisdictions across the country. Our primary goal is to make criminal and juvenile justice systems more efficient and cost-effective in order to promote accountability for achieving better outcomes. This webinar is the sixth in a 7-part series that takes place each second Wednesday of every month until September. We developed these webinars in follow-up to the release of our stakeholder box set papers, which CJI created under a cooperative agreement with the National Institute of Corrections. The box set papers focus on the application of evidence-based principles for reducing recidivism. The papers are addressed to various criminal justice stakeholders and discuss how the implementation of evidence-based practices and a focus on reducing recidivism affect areas of expertise in community corrections, judiciary, prosecution, defense, pretrial services, jail, prisons, and the provision of treatment. Each of these papers is available for free download on CJI's website. Our webinars have been thoughtfully designed to reach diverse stakeholder groups by incorporating their various perspectives, all aligned by the principles of evidence-based practice. Our vision for these unfunded webinars is to build a community of learning and a network of practice among various criminal justice stakeholders as we work together to improve our communities. Today's agenda will cover the following areas. First, a brief featured presentation, followed by a panel discussion and interactive question and answer session where the panelists will respond to audience questions. To begin this webinar, we have 2 quick polls for you, our audience. First, we want to take a moment and ask you whether you've had a chance to review the papers in our box set. The results of the poll show that the majority of you have not yet been able to view these papers. Again, they are available on our website at www.cjinstitute.org, which is located on the bottom of the slide on the screen now, and will also be available later in the webinar. We'd also like to get a sense of whether or not you work primarily in a city, county, state, or federal jurisdiction. Please log your responses now. The results of the poll show that the majority are in county and state jurisdictions, while we also have a good showing of federal employees and a small portion of city employees as well. We're glad to see the diversity in our audience, and we'll be sure to keep that in mind as we feed through the questions during the panel. We want to remind you that at any time throughout the webinar, you can submit panel questions directly through the question function on your screen. We will try and answer as many questions as time allows, and we'll make available the remaining responses via a frequently asked questions sheet that will be accessible through CJI's website. The FAQ sheet, the PowerPoint with audio, complete panelist bios, and other resources from our panelists will also be available for download on the website free of charge. We hope that you enjoy the webinar and look forward to hearing your comments and feedback on the brief evaluation following the completion of the event. We have used the feedback from previous webinars to make modifications to each event and to be more responsive to audience requests, so we encourage you to take a moment to offer your feedback. Before we introduce today's featured presenter and panel members, we'd like to recognize and thank the primary author of the Clinical Practices box set paper, Wayne Scott. We'd like to thank you for your insight and expertise in this area. And now we'd like to introduce our featured presenter, Ms. Ginger Martin, Assistant Director, Oregon Department of Corrections. Ms. Martin is currently an Assistant Director of the Oregon Department of Correction, responsible for community corrections, institutional programs such as addictions treatment and cognitive programs, inmate education, religious services, as well as several other related functions. She has 30 years experience in state-level corrections policy and in addictions treatment. She has consulted on issues related to corrections policy and offender treatment programs at the county, state, and federal levels. Ginger holds a master's degree in social work. She currently serves on the boards of the International Community Corrections Association and the Women's Commission on Alcohol and Drug Issues of Oregon. Welcome, Ginger.
Thanks, Kate, and it's really an honor to be part of this conversation today.
We're happy to have you. Next, we have Ms. Maureen DeLude, Program Manager, Contractor Data Collection System within the State of Connecticut's Court Support Services Division. Maureen DeLude received her Master's in Public Administration from the University of Connecticut and has been employed by the Connecticut Judicial Branch for 22 years, the 4 most recent years for Connecticut's Court Support Services Division. The division is responsible for pretrial services, adult and juvenile probation, juvenile detention and family services, along with a wide network of contracted service providers that deliver services such as mental health and substance abuse treatment, cognitive behavior groups as well that address criminal thinking and antisocial behaviors. As the program manager of the division's contractor data collection system, Maureen leads a talented team tasked with designing, implementing, and quality assuring a web-based database for treatment service providers and creating opportunities to use that data through reports and research. In 2005, the division's contractor data collection system was developed to enhance the division's ability to use empirical evidence to support data-driven decision-making. CDCS, the system is also known, is an innovative data system that collects client-level treatment process and outcome data. Welcome, Maureen.
Oh, hello. Thanks so much for having me.
Thank you. And next we have Dr. Faye Taxman, University Professor of Criminology, Law, and Society at George Mason University. Dr. Taxman serves as co-director of the Network for Justice Health and director of the research program in evidence-based corrections and treatment at George Mason University. She is recognized for her work in the development of the seamless systems of care models that link the criminal justice with other service delivery systems, as well as re-engineering probation and parole supervision services and organizational change models. Dr. Taxman has published over 100 articles, including translational work such as The Tools of the Trade, A Guide to Incorporating Science into Practice. Welcome, Faye.
It's a pleasure to be with everyone today. Thanks for having me.
We look forward to the discussion, Faye. Thank you. And finally, I'd like to introduce Dr. Chris Lowenkamp, Probation Administrator, Office of Probation and Pretrial Services. Dr. Lowenkamp is a program administrator for the Administrative Office of the U.S. Courts. Prior to his appointment at the AO, Chris was a research professor and director of the Center for Criminal Justice Research at the University of Cincinnati. He is currently working on the implementation of risk assessment in the federal pretrial and probation systems, as well as the development and evaluation of skills training for pretrial and probation officers. Research interests include risk assessment, program evaluation, and fidelity of implementation. Welcome, Chris.
Thanks for having me.
Well, thank you, everyone. We appreciate your time with us, and at this time, I'd like to hand over the webinar to Ms. Ginger Martin, our featured presenter and moderator.